Hi, my name's Rachel Prey. I'm a third year medical student from Nova Southeastern College of Osteopathic Medicine. And today I'm going to be talking about a case presentation of a chronic venous insufficiency case in an otherwise healthy 74-year-old female. And I think this is important to talk about because chronic venous insufficiency is actually an extremely common condition, and it doesn't just affect patients that have a lot of comorbidities, such as we see a lot of patients with hypertension and diabetes. Not that that's not important to note, but I think this is something we should note because this can also affect the patients that you may be a little bit less worried about due to its many etiologies, such as venous hypertension, incompetent valves, suffering from the effects of pregnancy, fibrosis in the veins, and just having a genetic predisposition. And then also something that's important to note is it is affected by standing for long periods of time. So as healthcare professionals, we should be aware of this as we stand. So in this patient, we had a 74-year-old female, and she had bilateral lower extremity heaviness, achiness, and burning sensations in her legs. And other than that, her past medical history was insignificant, other than some hypertension and dizziness. And she was a generally quite healthy woman, and she did have some changes in skin color around her ankles, and then pitting edema in her legs, and some swelling in her lower legs. So that should be noted for our venous insufficiency patients for physical exam findings that you want to look for. And then when you're doing the workup for venous insufficiency, you want to make sure that you're not getting it confused with peripheral arterial disease or neuropathy. So in order to rule out peripheral arterial disease in this workup, we did an ankle brachial index and also a pulse check, and her pulses were healthy and 2+ bilaterally. So there was no problems there, and she didn't have any history of smoking or anything like that. So then we went ahead and did a venous duplex ultrasound to assess the resistance of the blood flow through the veins. And she did have venous reflux, which means that as the blood flow went down the legs, there was no problem getting down the legs, but as it's getting up the legs, the valves are no longer helping to push the blood up the legs. So you're getting more of that blood flow back, thus giving you the higher venous reflux. So from there, and this patient, actually, it should be noted, she had already tried compression stockings, which is the basically first step that you want to do for your venous insufficiency patients. And she did not get relief from that. So the vascular surgeon that I was working with on this rotation specializes in doing stents and venograms. So it was a venogram, which is taking a picture of the vein, and a possible stent placement was planned. So then if we go over to this flow chart, it kind of gives the flow in just simplified form of the patient complains of leg pain. You rule out peripheral arterial disease. You do the outpatient procedure of the venogram with possible stent placement in an outpatient cath lab, which was performed. And then an IV ultrasound is placed in the vein to show the diameter of the vein and to show if there is stenosis and blockage. So you can see in this first picture down below, that is what the veins looked like bilaterally. The iliac veins and the femoral veins on the leftmost, and then the right. And then the right, so her veins showed that she did have more than 50% blockage with due to fibrosis in her veins, which is contributing to the venous insufficiency. So a stent was placed because the standard of care is if there's greater than 50% blockage for the veins, then you can place a stent. And then the contrast is shown with the stent placement for showing the increased patency of the veins. And the reason why this is important is because venous insufficiency can affect patients of all backgrounds and health statuses, and it's something that is very common. So all physicians and students should be familiar with the workup and how to identify venous insufficiency in patients. And something that we should note is varicose veins and excessive spider veins are important, and they could be the first signs of venous insufficiency. And then also just knowing how to distinguish between peripheral arterial disease and venous insufficiency. So with venous insufficiency, the patients will have leg pain when they're sitting for long periods of time because because the blood is not getting pumped up with the muscles of the legs. But then when they walk, the blood is going to get pumped up with the muscles of the legs, so they'll have relief at that time. So there are many different options and ways to manage this. There's no cure for venous insufficiency, but there are many treatments, and stent placement and using venograms is just one way to help these patients. Thank you.
All righty. Thank you so much, Rachel. Is there any questions out in the audience? All righty. And